Here we are at Texas Pediatric Dentistry, where my mentor, Dr. Kristen Crabtree, is a trained pediatric dentist. Pediatric dentists are specialized in working on patients aged 6 months or as soon as the child starts growing teeth to their teenage years, where they will then move on to a general dentist. Come on, let's go inside.
Hi, I'm Kristen Crabtree. I'm a pediatric dentist at Texas Pediatric Dentistry, and I'm Taylor's mentor. So just a little bit of background about me. I'm from Texarkana, Texas. I went to high school. I grew up there. And then I went to the University of Arkansas for college, where I majored in biology. I actually did not know that I wanted to be a dentist until I was a junior in college. I went to Texas A&M, Baylor Health Science Center, College of Dentistry. It's in Dallas, Texas. So dental school is 4 years long. So my goal going into dental school was to be a general dentist. I did not know through most of dental school that I wanted to be a pediatric dentist. So I decided my third year of dental school that I wanted to be a pediatric dentist. So what brought me to that decision? Kids are amazing. They're so fun to be with. They are so honest, they're so sweet, they're so hilarious, and they actually really enjoy coming to see the dentist, believe it or not.
The road to becoming a pediatric dentist is not an easy one. A person must go through 4 years of undergraduate school, 4 years of dental school, and 2 to 3 years of residency, where they will then be eligible to become a pediatric dentist. But if a person is not interested in being a pediatric dentist, they have many different options. For example, they could become a general dentist, an orthodontist, a periodontist, or there's many other options in the dental field.
Hi, how are you today?
I'm great. How are you?
I'm great. Thank you so much for asking. Who are you?
My name is Amy Martinez.
My name is Michaela Gervais, and I'm an 8th grade teacher.
Let's get into some questions, shall we? What age should you take your child to the dentist?
Well, my pediatrician said 3.
I was told as soon as they start cutting teeth.
I would say 4.
So we'd like you to start taking your child to the dentist by the time they get their first tooth, which is about 6 months of age, or by their first birthday. The earlier that you can bring them to the dentist, the better, because we want to make sure that their teeth are nice and healthy. We want to give the parent, let the parent know what to expect for the future. And also, if they do come in when they're older, a lot of times they have cavities. We don't want their first time to come in to the cavity.
Next question. How many baby teeth are there?
20.
A lot.
20.
So there are total 20 baby teeth.
What about adult teeth?
26.
There's more. Like 24, 26, something like that.
30.
There are 32 adult teeth, so 20 baby teeth that you'll end up losing, and then you'll have 32 adult teeth that replace those 20 baby teeth.
What age do you start losing your teeth?
As early as 5 or 6.
4.
Kids start losing baby teeth around 6 years old. It starts with the bottom 2 front teeth, and some of those baby teeth you keep until about 12. Girls are sometimes more advanced than boys, so they might start losing their teeth a little bit before boys. Boys might not be losing their teeth at 6, so if you see anyone around 6 years old and the parent says, "Why hasn't my son started losing teeth?" That's okay, it's totally fine. The adult boys do sometimes lose their teeth a little bit later.
When should you have all your adult teeth?
By 13 or 14.
You generally lose all your baby teeth by about 12 years old. Again, girls sometimes might lose theirs slightly earlier. And then you have most of your adult teeth by 12 years old. The only teeth that you will not yet have are your wisdom teeth, which are also known as third molars. Sometimes those teeth come into the mouth around 16. Sometimes they always stay down in the jaw and then have to be removed when you're a little bit older by an oral surgeon.
True or false? Milk can cause cavities.
True.
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 Yes, milk can cause cavities on teeth. A lot of times babies are put to bed with a bottle of milk, and that makes them much more prone to getting cavities in their 20 baby teeth.
True or false? Fluoride toothpaste is good for your teeth.
True.
Yes, but only at a certain age, because children are not supposed to have fluoride.
True.
True, fluoride is very good for your teeth. It's also in the water system. I know sometimes parents think that fluoride can be bad for you, but it's actually great for your teeth, and it's in the amount that it would not be dangerous for you.
Why do we fix baby teeth?
To prevent further damage.
We fix baby teeth because so the adult tooth can grow it.
Primarily cavities. I would just think overall being proactive about their health because of what they eat and brushing teeth and things like that. But as far as fixing, I would assume that cavities would be.
Baby teeth are very important. So a lot of times parents will come in and say, why do we need to fix that cavity? It's just on a baby tooth. First, we do have some of the baby teeth until about 12. So if there's a cavity, I always explain to parents. Teeth have different layers. The outer protective layer is very thin, so when there's a start of a cavity, it's fine if it's in the outside layer. But what happens is it gets the inside surface of the tooth, and from there it can get large very quickly. So what we don't want to happen, we don't want the kid to be in pain, we don't want the kid to get some sort of infection, an abscess, where then they're coming in for emergency treatment because they're in pain. We end up having to take out a tooth. The purpose of baby teeth is, of course, for function. We have to eat. They're very important for eating, of course, because we all like to eat. They're important for aesthetics. If you are missing a lot of your baby teeth, you don't have the smile that you would want your child to have. Another important thing is that those baby teeth hold space for when the adult teeth come in. If you lose a baby tooth early, it can mess up the space of the other baby teeth, which in the long run could block out an adult tooth from being able to come into the mouth, which then you have to get braces. So baby teeth have many important functions, and we want to keep those nice and healthy until they're lost.
How often should you visit the dentist?
Twice a year.
Every 6 months.
2 times a year.
Recommend that you come to the dentist every 6 months, which is 2 times a year. Sometimes if you need a kind of a little bit better cleaning, or a lot of times the kids in braces that need a little bit of help a little bit more often, you might see them every 3 months, but the majority of the time, every 6 months.
True or false, cavities can't be spread through kissing or genetics?
False?
It's a toughie. I'm gonna say true.
True.
False. Cavities actually can be spread. A lot of times, if for a child, if a mom's kissing on the baby, or if you share utensils, that bacteria can actually spread from one mouth to another. The type of bacteria in a mom's mouth, if you compare that to the type of bacteria in a baby's mouth, the majority of the time, those bacteria are almost identical. So bacteria can be spread, which means cavities can be spread.
What should you do if you knock out a baby tooth?
Put it on ice in a baggie and take it to the dentist?
Leave it?
You should put it under your pillow.
If you knock out a baby tooth, just leave the tooth out. It is unfortunate because you don't want to be missing a tooth, but if you put the tooth back in, you're more prone to damage the adult tooth, and of course you want to keep those adult teeth nice and healthy.
What do you think you should do with a permanent tooth if it knocks out?
Well, they have fake teeth, so you can just get one of those.
We've actually had a scenario where that happened to Juan. He was playing soccer, his front tooth fell out, and his dad was hanging on by like a nerve ending, and he shoved it back in and held it there till they got to the dentist. It is still attached, however, it is dead. So it's calcified. So we have to monitor the health of it. But in the moment, the dentist told Juan's dad that he actually did the best thing, was to like put it back in there and leave it until you can get to the dentist.
You should go to see the dentist.
If you knock out an adult tooth, which is also known as a permanent tooth, the first thing that you want you to do is pick it up. If it's really dirty, if it's fallen in dirt, go ahead and rinse it under water. Hold it by the crown of the tooth, which is the white part that you can see in the mouth. The root holds the tooth into the bone. So what I want you to do is pick it up, put it back in place, and then immediately go see your dentist. If the tooth is out for too long, the nerve of the tooth dies, and then you end up needing a root canal, and that adult tooth could eventually be lost, meaning that you need an implant. So if you knock out an adult tooth, stick it right back in.
When should kids start brushing by themselves?
3, 4?
I would just say immediate, so it seems normal, and then always go back and spot check.
Well, I started brushing my teeth when I was 3.
So kids should start brushing by themselves, I would say around 8 years old. Some kids are a little bit more advanced, some kids are need help for a little bit longer, but kind of a general rule we tell parents, by the time they have the coordination to be able to tie their own shoes, which for most kids about 8 years old. And of course, if they're not doing the best job, we always have a parent go back, let the child brush around that age, and then the parent goes back after and helps them to make sure everything's nice and clean.
Let's see, true or false? A pediatric dentist cannot see a patient 25 years old with Down syndrome.
False.
I would say false. I mean, wouldn't their education and their skill trade be the same no matter if it's pediatric or not?
False.
False. We do see patients of different ages. For the most part, we see kids until about 18 years old, but we do also see multiple special needs patients. So if we have a patient with Down syndrome, we will see them really as long as they need to be seen.
And then last question, can pediatric dentists put braces on a patient?
False.
No, that would be the orthodontist.
No.
Technically, pediatric dentists can put braces on patients. General dentists can put braces on patients, but I always like to leave it up to the specialist. That's the orthodontist's job. That's what they're trained to do. So I always recommend that an orthodontist places your braces. But technically, yes, other dentists can place braces.
Well, thank you so much, Ms. Gervais. Amy, thank you so much for joining me today. I really appreciate your help. Good job, Madison. Thanks for hanging out with me.
Something new.
Tips for becoming a pediatric dentist. First, your main goal is, of course, to become a dentist. You have to become a general dentist before you can become a pediatric dentist. I always suggest going to shadow at a pediatric dental office, exactly what Taylor's doing for this class. I think that's a great thing to do. It helps you actually see what you'd be doing in the real world, and it's something that you're actually interested in. Once you decide that is something you're interested in, taking the classes that are going to get you where you need to be. So science classes are definitely very important for dentistry. Our background is all about science. We need to know the why to be able to do the how to actually get things taken care of. So science is very important. I've majored in biology. I would say the majority of my class majored in biology, but you could also do biochem, chemistry, any other sort of science classes that will get you the requirements needed to get into dental school. If you're looking to own your own practice, I always think it's a great idea to take business classes. That's something I don't think a lot of people are informed about. So if you're able to take classes in college of business and running a business, that will help you out definitely in the future when you're trying to own your own practice. Once you've taken all those classes, the next thing is to get into dental school. So you have to take an exam. It's called the DAT. So you have to study for that. There's different courses that you can take. So you can take a course to help pass that test and do the best that you can. But you also have a lot of shadowing hours. So I know we were talking about shadowing, but I would say at least 100 hours of shadowing is something that will be important to show that you're actually interested in becoming a dentist and shadowing different specialties as well. Once you're in dental school, I would say the main thing is to really study, but also take time for yourself. So yes, there's a good balance. You have to study, but also have time for things that you enjoy. Yes, there's a lot of studying in dental school and many tests. Some days, some weeks you might have 11 tests a week. It's a lot. So you're going to be stressed and you're going to have to study a lot, but you also, like I said, need to take time for yourself. If going to the gym and working out helps you release some stress, do that. If spending time with your friends and family is something that you need to do, that's kind of what I did. I would take time, even during the times when I was needing to study, to take time for myself to be able to be with my friends and family to keep me sane. If you're not at the top of your class, it is okay. The good thing about dentistry is, hey, as long as you make it through, you will be a dentist. And personality is so important in dentistry. As long as you can talk to a patient and get the work done, you'll make an awesome dentist. So just keep going, even when it's hard. Keep your head up, study hard, and you'll be amazing.
Testing.
Pediatric dentistry is a dental specialty in which dentists are trained to work on patients aged We're here at Stonebridge Ranch Dentistry, where Dr. Taylor Niggle and Dr.
You want me to start? Yes. Sorry, you're gonna have to edit this. I apologize.
Girl. $30.
False.
Okay, I was going to say false.
That's why it's good to make sure everybody's flossing and stuff. So when you share those smoochies,